Hello and welcome to Long COVID Foundation podcast. This is the channel where we share education and information on long COVID to help you understand your symptoms better. In just a moment, Dr. Paul Marik will discuss the FLCCC created I Recover protocol for long COVID. So if you want to have answers, please watch this talk from start to finish because it will help you to learn more. What you will hear tonight is not personal medical advice. Take this information, take this protocol back to your physician to seek for the best medical advice which best suits you. And we are a non-profit organization offering education and information. We only came together to share this information on long COVID and raise awareness about this debilitating syndrome. We depend on your donations, and we thank you to many of you who donated for helping us to spread the message. Thank you very much, and let's jump straight into our interview. And welcome to Long COVID Foundation podcast. It's my pleasure to welcome Dr. Paul Marik, co-founder of FLCCC and co-author of I Recover protocol that we will be discussing today. It's such a great honor to have you back on our channel, and thank you for sharing your knowledge with our listeners.
Valentina, it's really a pleasure to be here, so thank you for inviting me back again.
At the same time, I would like to welcome Professor Antje Baranova from George Mason University, Director of Chronic and Metabolic Rare Diseases and Scientific Advisor of Long COVID Foundation. Welcome, Antje, to our channel.
I'm so happy to be here again, Valentina. And thank you for bringing so many interesting people together. I really enjoy our interviews.
Thank you so much. This is our aim and purpose. So, Dr. Marik, since our last interview, we know lots have changed. What has brought you to epicenter of the chaos, where you are fighting for the doctors to be doctors, which I would imagine is extremely difficult. Could you please share your recent story and where you are now in this battle?
Yeah. So, it's an unfortunate story. The problem is that, in the United States, particularly, the federal government, state agencies, and hospitals are basically telling doctors how to practice medicine, is that these institutions are interfering with the basic physician-patient relationship. In my entire career and across the world, doctors, evaluate patients, and they, based on their clinical judgment and expertise, decide what's the best treatment for their patient, obviously in consultation with the patient. But it seems that with COVID, things have changed, that it's being dictated how to treat patients. And for example, in hospitalized patients, there's a fixed regimen of remdesivir and low-dose dexamethasone, and that's what you use. And it seems like most physicians just follow like blind sheep without really thinking what they're actually doing. And the tragedy is remdesivir is a toxic medication that doesn't work. In fact, it's harmful. And dexamethasone is the wrong drug in the wrong dose for the wrong duration. So consequently, we developed the Math Plus protocol, which we think is based on good science and the best evidence. And most importantly, it has to be individualized to each patient. I think it's pretty common sense that not every patient is the same. They're going to have different severity of illness. And the treatment should be based on how sick they are. And that is kind of an absurd notion that every patient gets the same treatment. So what my hospital since March or April of 2020 is, I was treating my patients with a form of the Math Plus protocol. I wasn't allowed to use ivermectin, it was banned, but I was using a host of drugs that are off-label, safe, and have been shown to be effective for COVID, but obviously wasn't using remdesivir. So what happened then is in October, the hospital system sent out a memo to the entire hospital system, but basically targeting me, saying that the hospital pharmacy would no longer dispense these medications that I had been using for treatment of COVID. So basically, they tied my hands. I was unable to do what I have been doing my entire career, and what I was doing for these patients is treat them the way I thought was clinically appropriate. So unfortunately, the first week that I went back to work, I had 7 COVID patients. I was unable to treat them with what I wanted to do. All 7 of them died. Which was an absolute tragedy, including a 31-year-old woman. And obviously for me, that was just immoral and unconscionable. And, I couldn't do that. So I didn't have many options. So I tried to sue the hospital. And I discovered that that's somewhat of a daunting undertaking, because they have enormous influence and power, and basically can destroy your career, which is what they did. They don't like people standing up against them. So what they did is something called sham peer review. It's something I didn't know what this was. So basically what they did is they invented a whole host of outrageous complaints and accusations against me, which were completely false and fabricated and made up. They didn't provide any evidence to support these, any documentation. And then based on these ridiculous charges, they then suspended my hospital privileges, basically stating that I was a severe threat to the health and well-being of the patients. It was completely made up and fabricated. And they say it was not related to my lawsuit, but it was. The letter was sent the exact same day that we went to court, so it was clear retaliation. Unfortunately, when we went to court, the hospital lawyers and their witnesses lied under oath, which they do. So, we had filed an injunction to allow me to treat my patients the way I saw fit, but unfortunately, the judge didn't really follow what was going on, so we didn't get the injunction. And then, obviously, I was no longer employed by the hospital, so the suit became, a moot point. So I was kind of forced to resign. But you know what? I'm not giving up the fight. And what we're trying to do is we're trying to work with legislators in different states in the United States, just trying to prevent these kind of things happening. Basically, to let doctors be doctors, because the state hospitals are telling doctors how to practice medicine, which is not the way it should be. And indeed, even in the US, the pharmacists are intervening. When doctors write a prescription and go to the pharmacy, the patients take it to the pharmacy, the pharmacists are refusing. They're acting as physicians now, and we're trying to stop that as well. So unfortunately, unless you follow the standard narrative that's being propagated by the state agencies, the vaccines are safe and effective, you follow our treatment guideline exactly, you don't deviate, you're seen as a rebel and an outcast and an anti-vaccination person, and they target you. So that's what happened to me. But you know what? We're going to continue the fight, because, I think the truth will come out, and I think we're on the right side of the truth, and we're on the right side of science, and you have to stand up for what you believe in. And, the censorship, they're basically censoring and silencing any opposition, which goes against the core of science.
So today, Dr. Marik, would love to hear your view on how to tackle long COVID from iRecover protocol perspective, and whether it will bring any changes considering the Omicron spread.